I'll answer that question in different ways. So people often say that, but if you look at the Office for National Statistics and you look at actually breast cancer, lung cancer, and other cancers, that depends on what stage of cancer you are. So glioblastomas, by definition, is a grade 4 tumor, and you can maybe correlate to being stage 4 with breast and lung. And if you look at that and think of it like that, in fact, you have worse outcomes with stage 4 lung cancer than you do with glioblastoma by a significant distance. So we need to compare like with like. We can't just say glioblastoma to breast in general or colorectal in general. We need to compare glioblastoma with stage 4 disease of other cancers. And what you'll find is that in some cases, glioblastoma patients actually live longer. And so that's often not said. If you compared, for example, glioblastoma to stage 1 lung cancer, stage 1 breast, then of course you're going to have disadvantageous survival. But if you compare it to stage 4 breast, stage 4 lung, stage 4 colon, you have to really look at that properly. So what can be done? So a few things. The brain is a very difficult place to access. You cannot hold brain in your hand, turn it around, have a three-dimensional macroscopic view of this. Oftentimes you're trying to minimize damage to normal neural structures by removing something that's quite aggressive. Also, the understanding of the disease may need to change. It's a disease which is of white matter tracts, and what you see at diagnosis, even the most detailed MRI imaging, is the point of the iceberg. The true underneath of the iceberg in white matter tracts we don't see. So if we approach it like that, that can change maybe our surgical intervention to do gross total or supramarginal resections, also adjuvant therapy regimes. And so in terms of what can be done more, you may need to have a fundamental rethink about exactly what this disease is from both a surgical perspective and oncology perspective. Because at the moment, we've not made, if you just even take even the most updated, fantastic surgical techniques, if you don't have any adjuvant therapy, your outcomes are pretty much no different to something 100 years ago. You know, Dandy was doing hemispherectomies over 100 years ago, and the patient still then developed contralateral disease. So we need to have a rethink of exactly what this is for our patients and for us.